There are many known risk factors for developing breast cancer, including both things that we can and cannot change about our lives. So, some of the most common ones are female sex, age, risk does increase with age. Family history of breast and ovarian cancer also can be a risk factor, although it does depend on the specifics of that history. Having a denser breast tissue, which is just something that some people have, is also a risk factor. Drinking alcohol, even in moderation, is another risk factor. Carrying extra weight after menopause is another, and living a sedentary lifestyle, so not exercising, that is another risk factor. And another risk factor that is more individualized is the exposure that we have to hormones over our lifetime, including hormonal medications, but also just the hormones that our body produces naturally, which is actually more complicated than it sounds.
Hello, and thank you for listening to the HOCO Health Podcast, a podcast produced in a collaboration with the Howard County Health Department and Howard Community College, where we discuss topics on all things public health. I'm Howard County Health Officer Dr. Maura Rossman. October is Breast Cancer Awareness Month, and in today's episode, we're dedicating our discussion to raising awareness about this critical health issue. Breast cancer is one of the most common cancers affecting women, but with early detection and increased understanding, survival rates continue to improve. Join us as we talk with two of our health department professionals to explore the importance of regular screenings, ways to reduce risk, and the resources available to support those impacted. Whether you're here to learn for yourself, a loved one, or to share this knowledge with others, we're here to help you navigate the journey of breast cancer prevention and breast cancer treatment and care. Here are some key statistics about breast cancer. Breast cancer is the most common cancer diagnosed in women in the United States, aside from skin cancers. It accounts for more than 30% of all new female cancers each year. In Howard County alone, an average of 266 women are diagnosed with breast cancer each year. Our rates are slightly higher than Maryland and the U.S. overall. On average, each year in Howard County, 31 women will die from breast cancer. The better news here is that our mortality rates are lower in Howard County than in Maryland and the United States. We will explore with our guests why perhaps Howard County has a higher number of women being diagnosed with breast cancer, but yet fewer dying. So let's get started. Our first guest is Dr. Emmanuel Noor, the public health physician at the Howard County Health Department. Welcome, Dr. Noor.
Thank you so much, Dr. Rossman. I'm happy to be here.
So glad you could join us. These are important topics, and I know you provide reproductive health care and general medical care to women here at Howard County Health Department. So again, appreciate your expertise and taking your time to join us today.
Thank you.
So let's just start with what breast cancer is, how it develops in general. Can you share with our listeners?
Sure. Cancer is just what we call it when cells in the body grow and divide in a way that is not normal and in a way that can spread to other parts of the body beyond where that abnormal growth started. Breast cancer is what we call it when that process of cancer starts up in the tissues of the breast.
Now, I just shared that breast cancer is one of the leading causes of cancer among women. Women have breasts, and yes, abnormal cells start to grow. Can you share a little bit about, I'm going to say, the common risk factors for developing breast cancer? And are there any less known but still significant risk factors that's worth sharing with our listeners?
Absolutely. There are many known risk factors for developing breast cancer. including both things that we can and cannot change about our lives. So some of the most common ones are female sex, age, risk does increase with age, family history of breast and ovarian cancer also can be a risk factor, although it does depend on the specifics of that history. Having a denser breast tissue, which is just something that some people have, is also a risk factor. Drinking alcohol, even in moderation, is another risk factor. Carrying extra weight after menopause is another, and living a sedentary lifestyle, so not exercising, that is another risk factor. And another risk factor that is more individualized is the exposure that we have to hormones over our lifetime, including hormonal medications, but also just the hormones that our body produces naturally, which is actually more complicated than it sounds. So it includes things like the age at which you got your first period, how many children you've had, if you've had any children, at what ages you had those children, what age you go into menopause, and which hormonal medications you've taken specifically and for how long. So it is very individualized. And I think you also asked Dr. Rossman about some of the lesser known risk factors, since I think many people might have heard about most of the ones I just listed. Some of the lesser known risk factors can still be significant. These tend to be more about the individual's health history. So if you've received radiation treatment to the chest, typically done for a different cancer, that's a major risk factor. Being diagnosed with a genetic disease or cancer syndrome that raises your cancer risks is another risk, as well as having a personal history of breast cancer. So if you've had breast cancer yourself in the past, it does raise your chance of getting it again. Having diabetes is another risk factor, and being diagnosed with certain breast diseases, which are not cancer themselves, but can predispose to developing cancer. There's a few different ones that fall into this category called proliferative diseases of the breast. I should also note that all of that said, breast cancer is, for the past couple years, has been the most common cancer diagnosed in the United States. So even folks who do not necessarily have added risk factors for breast cancer are still at risk, especially as we age. And on the flip side of that, having one or even a few risk factors for breast cancer does not mean that you will definitely get it.
Right. So you mentioned there's some risk factors that aren't modifiable, which we'll talk about genetics and family history. And then there's some modifiable things that we can do, lifestyle and other things to decrease our risk. The other thing, we're talking about women, right? But men can also develop breast cancer because men have breast tissue too. So anyone with breast tissue, which is anyone, unless you've had your breast tissue removed, can develop breast cancer. So I think, this topic that we're talking about and bringing awareness to particularly early detection and treatment and the success rates related to that is really important. So I'm so glad your listeners are out there. So let's go back a little bit to what you said, Dr. Noor, because I'm in a family where my grandmother passed away from breast cancer. My sister has stage 4 breast cancer, which she's doing well right now under treatment. How does genetics play a role, particularly mutations and other things that maybe we should be aware of that we can get tested in if we have a family history of breast cancer?
Absolutely. And I'm really sorry to hear about the losses that you've had in your family, Dr. Rossman, but I'm glad your sister's doing well.
Thank you.
Genetics can play a significant role in breast cancer for some people, although I will note that most breast cancers are not actually related to a genetic cause. So over time, by studying families that unfortunately had many cases of breast cancer, we have been able to identify some patterns and even some specific gene mutations that very strongly predispose to breast cancer. For example, I think the most well-known one is a condition called BRCA, BRCA, which is an inherited genetic trait that greatly increases the chances of developing breast cancer. Outside of having a diagnosed genetic cancer system like BRCA in your family, it is also still a risk factor to have one or more first degree relatives, and first degree relatives are your parents, your siblings, and your children. And I should clarify, your biological parents, siblings, and children. So if any of those relations have had breast cancer, that does have an implication for your risk. And doctors may use that as well as other factors to refine the estimate of that risk from your family history, including if any of your other relatives who aren't first degree have had breast or ovarian cancer, and the age at which your relatives were diagnosed. So for those who do have an elevated risk based on family history as determined by their provider, the next step is usually to be referred to a genetic counselor who can further kind of refine or recommend additional testing to determine your risk in addition to the screening.
So are you suggesting that if any listeners out there have a family history or unknown, that they talk to their primary care provider who may be able to refer them or give them some advice as to whether or not additional testing is needed?
Yes, absolutely. And I have some specific tips about that. I would say, yes, please make an appointment to see your primary care provider or OBGYN provider to review your own individual risk factors in your screening history and determine the best next step, including whether they might need to order a test for you now. In preparation for that appointment, do your best to gather any information you might have, including clarifying the history of any cancers in your family. So this might mean calling around to relatives or whoever might in the family be most knowledgeable to confirm how those folks who had cancer are related to you, what type of cancer they specifically had, about how old they were when they found out they had cancer, and during their treatment, did a doctor ever either test them for genetic causes of cancer or advise them to get tested for genetic causes? I know that might sound like a lot, but as a family doctor, I can't tell you how many times I had someone who came in and they really wanted to make sure that I really knew about Aunt Susie's history of cancer so I could tell them how relevant it was to them. But then when it kind of came down to it, they maybe can't quite remember how they're like biologically related to Aunt Susie. And actually, did Aunt Susie have breast cancer or was she the one that had lung cancer? And then also how old she was, I don't know. That was like before I was born. So it sometimes like it takes a little more digging. And then at the time of that appointment, I would make sure that you're very clear with your provider that your main reason for coming in is to specifically discuss your cancer screenings. So I know it's hard to make sure you have enough time to really get into it, I would make sure they know that it's number one on your list. And then once your provider orders a screening test for you, it might sound simple, but make sure to get it scheduled and to get it done in a timely manner. And then also importantly, be sure to close the loop and make sure you understand the result and the next steps based on that result. So that could be as simple as looking out for a letter in the mail or logging in to your patient portal, or you may also have to call or schedule a follow-up appointment to find out, kind of what the next step is.
Those are great tips. And that actually happened in my family. I have an adult daughter who was at a primary care visit and was asked questions about breast cancer. And then she had to phone a friend. She called me at work asking all about, wasn't Aunt Susie, because all of this happened when she was younger. And even though she may have heard about it, it wasn't really relevant, to her at the time. And I was able to provide her information about BRCA or non-BRCA gene and when my sister got breast cancer, all those things that were really, I think, helpful for her provider then to make the appropriate recommendations for her. So yes, I encourage everyone out there, talk to your aunts, talk to your mom, your grandmom, your dad, whoever may have that information to help you later on when you talk to your provider. So great tips. So let's talk a little bit about screening for breast cancer, because I think we've learned that early detection really will improve survival rates. So what currently are the recommended screening methods for breast cancer, including what age should most women start mammograms?
Absolutely. So, and just to kind of define my terms, so screening means checking for something that we don't have any reason to believe is there right now, just to check and be sure. So, this is different than testing for a disease that we're worried you might have or probably is there. The point of doing a test like this for someone who probably does not have breast cancer is to be able to find those cancers or other conditions early when they're more easily treated than they would be if we waited until the person developed symptoms and was sicker. But to answer your question, Dr. Rossman, the test we use to screen in almost all cases is called a mammogram. A mammogram is a special type of X-ray that is done by placing the breast between two flat plates under a firm pressure to flatten out the breast. And then a special X-ray is taken of that flattened shape on each side. Most people find that process kind of awkward and uncomfortable, but usually not painful. There are multiple groups in the medical world that weigh in on the specifics, exactly when and how much to test, and guidelines have changed over time, including some recent changes. But as of now, there is a consensus that those of female sex who are at roughly average risk, so people who don't have major risk factors, should start getting mammograms at the age of 40. And I will clarify that that group of female sex folks includes cisgender women, so women who were assigned female at birth and still identify as women, as well as transgender men and non-binary people who were assigned female at birth. And then typically, if the mammogram is normal and the person is at average risk, the mammogram should be repeated after 1 to 2 years. There's a little bit of disagreement from societies about which number to use, but if you stay within that time period, you should be okay. And then if the mammogram does see something that they might need to keep a closer eye on, or the person is at a higher risk, more tests might need to be done after that or repeated sooner than they otherwise would be.
So thanks. Yeah, I'm pointing out that what you just discussed is generally for women or individuals with normal risk factors. And that, yes, the testing may be different if you have a problem rather than screening, which is generally for people that don't have a problem, but we just want to make sure.
Yes, exactly. And also for some people who have very significant risk factors, they may also need to get additional or enhanced screening, even though they don't have symptoms yet.
So screening, and we're going to talk more about screening and screening that the health department provides. Let's go back a little bit to lifestyle changes. We talked a little bit about the genetics that contribute to risk factors, but you also in the very beginning talked about a number of what I call modifiable behaviors that individuals who want to reduce their risk may wish to try. So can you share about some preventative measures or lifestyle changes that may reduce the risk of breast cancer in an individual?
Yes, absolutely. So there is a known link between some lifestyle factors and breast cancer, specifically drinking alcohol. And this applies even to folks who drink a moderate or light amount of alcohol. So there appears to be no quote unquote safe amount of alcohol that you can drink that would not play into breast cancer risk. So I would recommend thinking about decreasing or stopping alcohol intake. Inactivity or lack of exercise is a very clear breast cancer risk factor. So I would recommend, working on increasing exercise, whatever you can do. The goal I would usually counsel people on would be to get 150 minutes of moderate intensity exercise per week. Moderate intensity exercise being absolutely anything at all that gets your heart rate up enough that maybe you couldn't sing while you're doing it, but you don't have to go so hard that you couldn't talk. And you can break that down however you like in the week. And There is also a risk factor associated with gaining weight after menopause specifically, so that might also be something to keep an eye on.
And so many of the things you mentioned not only would be helpful in reducing the risk of breast cancer, but a number of chronic health conditions, as well as just plain having fun and being good to us by, being more active, reducing alcohol, and watching our weight, especially after menopause for women. So
yes.
Let's just jump to maybe the last question here for you is, okay, individuals are going to get screened and they get diagnosed with breast cancer, which can be, I don't think just can be, which is very scary, right?
Absolutely.
Yeah. So what are the latest advancements in breast cancer treatment, and how have our outcomes improved over time?
Gotcha. Yeah, so the good news is that breast cancer deaths have fallen over the past 3 decades. The field of cancer treatment generally, and also specific to breast cancer, they have been working towards an increased understanding of how to use our own immune mechanisms to fight cancer and towards a more detailed understanding of the individual cancer that a person may develop as a way to target chemotherapy to the specific cancer. So those are developments that I think are going to be very much continuing and overall, hopefully, helping us reduce rates even further.
Yeah, so hopefully not so scary. It's always a scary hearing cancer, right? And then initially, when most people hear that, your brain starts listening because it is alarming. But the good news out there is that yes, our treatment is improving and our outcome data is also improving. So hopefully, people aren't so scared that they don't get their screening. We've been having such a great conversation. We're going to have to take a break. But when we come back, we're going to talk to Nurse and Cancer Program Manager, Sun Nicholas. Okay, we're back. We're talking about breast cancer during Breast Cancer Awareness Month. Next up, we have the Health Department's Cancer Program Manager and Nurse, Sun Nicholas. Thank you for being here, Sun.
Thank you so much, Dr. Rosamond, for having me today.
Oh, you're welcome. So glad you were able to take some time away from your work. And in particular, can you share a little about your program and what the Health Department offers for breast cancer prevention, screening, and treatment?
Yes, the Health Department has the Breast and Cervical Cancer Screening Program, which offers no-cost services for eligible individuals performed through a local contracted doctor or radiology facility. Breast cancer screening services include clinical breast exams, mammograms, and breast biopsies. Cervical cancer screening services include PET and HPV tests, colposcopies, and cervical biopsies. If a client has an abnormal result from the screening services, a registered nurse case manager will provide guidance, and additional program staff will assist the client with applying for the Maryland Department of Health Breast and Cervical Cancer Diagnosis and Treatment Program. If approved, the client can continue to receive diagnostic and treatment services at no cost for breast and/or cervical cancer. The goals of screening services are for early detection and to provide comprehensive support for individuals at risk of breast and cervical cancers.
Thank you, Sun, for that. I assume most of our listeners, I'm hoping you listeners out there all have some form of health insurance. And if you don't, you can also contact the health department so that we can help you get health insurance. But probably most HOCO residents listening out there have some form of either government or commercial insurance. But there are some in our community who may be underinsured or uninsured and who may benefit from the health department programs. Sun, can you share the eligibility requirements for our breast and cervical cancer treatment program?
Sure. So there are 4 specific eligibility requirements for the breast and cervical cancer screening program: age, income, residency, and insurance status. The program provides services to anyone who is 40 years of age and older, low income, lives in Howard County, and has no health insurance. These criteria ensures that the program serves those who may face barriers to accessing essential screening services. If the client is eligible but has insurance with barriers to care, the program can provide navigation with locating a provider and scheduling appointments.
So if there's a listener out there who doesn't have access to a provider or health insurance and wants to find out more about being screened for breast cancer, who would they contact? How would they go about doing that, Sun?
So the best way for someone to get in touch with the cancer program for any questions, they can call us at 410-313-4255. Our team is ready to assist with any inquiries or provide further information about our programs and services.
And is that information also on the Howard County Health Department website?
That's correct.
Great. So yes, you can always go to our website, or can you repeat that number again, Sun, where our listeners may call?
Yes, it is 410-313-4255.
Thank you so much. Now, we've had quite a few individuals come over the years to our health department, and some did have breast cancer detected and are doing really well. Sun, can you share a few success stories?
Last fiscal year, the breast and cervical cancer screening program successfully detected cancer in 5 clients. 1 of them is in the 40s, 3 of them are in the 50s, and 1 of them is in the 60s. These success stories highlight the critical role of the screening program in early detection and intervention, ultimately leading to improved health outcomes for our community members.
Yes, isn't that all what it's about, right? Trying to ensure that everyone in Howard County can benefit from the quality of life and longevity that they have. So thank you, Sun, for sharing about the wonderful program that you manage. We're going to take another short break. And when we come back, we'll talk just a little bit more about the topic of breast cancer. Thank you. All right, we're back and talking about breast cancer during Breast Cancer Awareness Month. I just have a few more questions for both of you that may provide some insight for our listeners. So for both of you, from a public health perspective, what are the most significant barriers to breast cancer screening and early detection? And how can we address these challenges among our community? Dr. Noor?
Thank you. I would say that there are many barriers. I think a barrier is just having knowledge of the need for screening and around what age we recommend folks do get started. So I think that's one. I think as you had addressed, Dr. Rossman, access to healthcare or other screening programs can be another major barrier. And I would add that even for some people who are insured, they may still have fears about how affordable the screening might be for them because they may have faced a higher than expected out-of-pocket cost for services in the past. But I would add that for breast cancer screening specifically, because of the high level of evidence in the official recommendation that it be done, it is required to be covered by your insurer without an out-of-pocket cost for the test specifically for the consumer. So I think that's another important factor. And I think there are also barriers that exist further down the road with, maybe you did have a mammogram and it was abnormal, but then the same barriers may apply to seeking treatment, for example.
And Sun, do you have a message for anyone who has been delaying a mammogram or other recommended breast cancer screening?
Yes, this is very important to, screen your breast cancer. So please contact your primary care provider or contact us so we can help you.
Great. Well, believe it or not, time is up. This has been a great and important conversation. I appreciate both Dr. Noor and Nurse Sun Nicholas for spending the time with us. Be sure to talk to your healthcare provider about getting screened for breast cancer and other cancers. It can save your life. For those interested, we have a Howard County Cancer Trends report on our website. If you're interested, go to www.hchealth.org and look under reports and data. You can stay up to date with what's going on at the health department by following us on social media at HOCO Health. And you can also listen to all of our podcast episodes at hocohealth.podbean.com, on Spotify, or wherever you listen to podcasts. I thank you all for listening to this HOCO Health podcast, and we hope you will join us again for a new public health topic. See you next time.